Hello everyone. I just wanted to touch base and let you know that so far I've had 4 of the proton therapy treatments. I started on Thursday and Friday, and then I had 1 on Monday and 1 today. My chemo was supposed to be today, I thought, but it's actually tomorrow on Wednesday. Today is, what is today's date? August 8th. After the first proton treatment therapy, I felt a little different. Not really sore, not really better, just different. The tumor is here on my left side, and it goes down into my throat, up into my nasal pharynx. That's why it's hard to talk. It goes into my tongue, and it's right next to my mandible and the base of my jaw. So they're hitting it with 4 angles. After my second round of proton therapy, that night it was sore. Not unbearable, but sore. I had therapy yesterday, and this morning I woke up about 4 in the morning. My throat, I had no Adam's apple. Both of these lymph nodes were swollen to the point where it looked like it was just my whole chin down here. The doctor said that's pretty much normal. Tomorrow starts my chemotherapy. I have a total of 35 proton treatments, and I have chemotherapy with the drug called cisplatin. 7 times. It's once a week. Tomorrow I start that. I went to have my treatment today, and I think the hardest part about this so far, other than the soreness, the hardest part is trying to get that mask out of your mind. When they made the mask, it took about a little bit over an hour. And basically it's a plastic mask. It comes in a sheet of plastic that they heat up in water. And then they put it over your face. And they buckle it to the table, the CAT scan table. They press it down to form it tightly to your face, into your eye sockets, over your nose, over your mouth. It comes down to about right here onto your chest. And you really can only breathe through your nose. It's a challenge. But I was able to, they asked me if I wanted Ambien or some kind of, Xanax or whatever kind of drug to get through it, because it is difficult. It's very claustrophobic. But I don't like drugs. I'm not a big fan. I know I don't have a choice in some matters, but as of right now, I'm just trying to relieve. Sorry, there's a guy cutting the grass here. There's a guy. I'm just trying to relieve my mind and pretend the mask is not there. It's not easy to do. But when you go in for your proton treatments, in this particular unit that I'm in proton room 3, and then there's room 4, 1, 2, and then whatever. But all of these rooms share a common beam. So as you're strapped to the table, if there's 4 people in these rooms, they go from one room to another room and back to another room while the machine's angles are changing for your treatment. So sometimes you're in there, typically you're supposed to be in there 25 to 30 minutes. Today, I was in there for 45 with my head strapped to the table, not being able to move. And the other hard part about it is the swelling in my throat with that mask. I mean, this is solid plastic. It's like a hockey mask without cushioning. And it presses against your face. When I get done, I went in to see my oncologist today. And by the time she got in there, it was an hour and a half, almost 2 hours after my treatment. And I still had the holes, the little round imprints on my face and my forehead and my neck from the mask. And she had said to me, she goes, "Oh my God," she said, "that mask must be really tight." And I said, "It is. It's not fun." So I have 30 more of those proton treatments left. My chemo starts tomorrow, and they also are going to give me dexamethasone, some drugs for my nausea that I'm going to get from the, more than likely going to get from the cisplatin. And the dexamethasone hopefully will reduce some of this swelling. I'm almost afraid to wake up in the morning tomorrow to see how much this has swelled after my treatment today. And my doctor prescribed Lyrica for me, but he told me to wait until after my first week of chemo to start taking it. He said at some point I'm going to need to take it. It's a nerve blocking agent, and it'll make it easier. It's not going to take the pain away. It doesn't take the pain from 10 to 0, but it will make it a little bit easier to manage without having to take opioids, or maybe take less of a dose of opioids, is what I was told. I'm not a big fan of drugs. Never was. Tylenol, acetaminophen, naproxen, that's it. Nevertheless, I just wanted to say that this is going to be a ride. I got a long way to go. They're confident they can cure me, but I'm not enjoying the ride so far. But there's really no options. Confident that they know what they're doing. And originally I was supposed to get 35 proton treatments. And my doctor told me that they've devised a different plan. I'm going to get about 40% of proton treatments, and I'm going to get the rest, 60%, is going to be regular radiation. And that'll be at the end. My last, I think, 20 treatments are going to be radiation. But according to him, there are limits to what the proton machine can do. And to the extent of the size of my tumor, they think that the radiation combined with the proton therapy is the best way to go to get rid of this. And I have to believe them. I have no choice. They're supposed to be the best, right? One of the best. I'm glad I got started. I'm glad I got down here. I got a lot of people to thank for getting me here. I'm right outside of Philadelphia. I'm staying at the AstraZeneca Hope Lodge for free. It's an amazing place. People are really nice. There's qualifications you have to go through to get in here, and they weren't going to allow me to get in here because I didn't have a caregiver with me. I don't expect anyone to put their life on hold, even though many of them have offered. But they declined me at first, and I was looking at getting hotel rooms for $100 a night down in Philly, $100 plus a night, and over the 2-month period, that would have cost me about $6 grand, $7 grand, plus meals and tolls. And I like to try and go back home on the weekends if I can. I just don't know how much longer I'm gonna be able to do that throughout this therapy. I've been told that the last 2 weeks of this is the hardest. I'm anxious to get to the last 2 weeks. But we'll get there. We're going to beat this. And for anyone else out there that has it, again, what I have is called squamous cell carcinoma. It's HPV related. Somewhere in my life, I contracted HPV from someone. I don't know where, and I'm not about to point fingers. That's immaterial. No one knows they have it unless they have a biopsy done. It's a very difficult thing to deal with because from what I've done some research, you can get it without even having sex with anyone. You can get it by deep tongue kissing, or in some articles I read, just skin contact, and you can get it. And once you have it, usually your immune system will destroy it. But if it doesn't, and it stays in your body over a lifetime, it can stay in there 20, 30, 40 years. I'm 53. I had no warning signs, no nothing. I had a very stressful couple of years. I lost both my parents going through divorce. I mean, I've had stress my whole life, but in the last few years, it's all culminated. And truly, what I think happened is I think this virus is inside me, and I just think my immune system dropped tremendously from overwork, sadness, depression, whatever you want to call it. And it opened up the door for this. And I developed this tumor. And as I said, I had my tonsils taken out on May 24th. Today is August 8th, 2023. 2 days after my tonsillectomy, my surgeon called to let me know that it came back. The pathology came back as positive for squamous cell carcinoma, HPV related. And we started this journey. I'm going to try to continue to eat, sleep. But the main thing is to eat. I have to be able to swallow the food or the water, both. it's already hard to eat. It's hard to talk. Again, this is into my throat down here, but yet it goes up into my nasal pharynx up in here, and half of my tongue. So sometimes it makes it hard for me to talk. The more treatments I get, the harder it's getting to talk. Nevertheless, I just want to tell everybody out there that cares about me, thank you. We'll get through this. We'll get through it. Two months of this craziness, and we'll be back. And I'll see you all then. I'll try and keep you posted over the next 30 days. Peace out, man.